Can compliance actually buy you peace of mind? Or is that just consultant speak? Welcome to the final episode in our 3-part series on compliance ROI. Over the past 2 episodes, Ronan dismantled the we don't have the budget objection and showed you his 3 Ps framework for measuring real compliance value. Today, Ross reveals what compliance investment actually buys you beyond the numbers, from board buy-in strategies to the intangible assets that let you focus on growth instead of risk. We also revisit the essential frameworks and real numbers from our full conversation that prove why this investment matters. By the end of this episode, you'll have everything you need to position compliance as the investment that protects what you've built and enables the growth you're working toward.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today.
Beyond the numbers, what else does compliance investment buy you?
It's really, a lot of it's peace of mind, right? So if you're thinking about, as a CEO, as a board member, we ask this question all the time. It's the age-old statement from compliance, right? What keeps you up at night? And, our slogan is coffee, not compliance, should be the only thing that keeps you up at night. So really, that is knowing what you need to know. And it's the things that you don't know are going to sink you. The things that you don't see, or I use the Titanic reference all the time, right? It's not the tip of the iceberg that's not the Titanic. It's the mountain underneath the water that they didn't see and tried to turn and they hit it. That's what sunk the Titanic, right? And if they would have known that the iceberg is this big instead of this big, they'd have turned a lot sooner if they would have seen it, whatever it may be. I don't know. I wasn't there, so I don't know what the actions were. But the idea is what's underneath the water is what's going to sink you. And so it buys you peace of mind to know that we're picking up rocks. One thing that is really important for everybody to understand, including the leadership, whether it's boards or CEOs or CFOs or COOs, it's not that you've found issues that is a big compliance issue. It's what you do with them to fix them that's really important. Everybody's going to find stuff. If it wasn't the case, compliance wouldn't exist. There would be no need for compliance programs if there was nothing out there to ever fix. It happens. It's not if, it's when. It's going to happen. It always does. And it's not about finding the issues. Yes, you need to find them. False Claims Act is knowingly or unknowingly causing a claim to be filed to inappropriately to the federal healthcare program. You still need to know what's going on, but it's okay that you find something. You just have to do something with it. You have to prevent it. You have to mitigate it from going on. Prevention, detection, mitigation, 3 pillars of a compliance program, right? Detect it, figure out what's going wrong, mitigate it, stop the bleed from happening, figure out how you're going to fix it, and then prevent it from happening by doing training and education. That's what the OIG wants to see. They don't want to say, you don't ever have problems. I don't believe that. They want to say, yes, you found problems, you fixed them, you moved on, you gave money back, you fixed it. We're not worried about it, right? So it's those matters that I think are really important. That's what buys you. It buys you a sense of peace. It buys you a sense of security in your investment in the organization. And that investment can be financial, it can be reputational, it can be anything associated, even as an employee. You're working there. It's going on your resume, right? Do you want to be a part of a program or a company that gets in trouble? So you want to make sure that you're investing in that and know what you know. So I think there's a lot of things that just say, it buys you peace of mind and it buys you comfort that you have invested your life, your career, your money into a company.
What's the one thing you want every healthcare CEO to remember about compliance budgeting?
First and foremost, don't think of it as a cost. Think of it as an asset or an advantage to your organization. Secondly, set it and forget it. Make the commitment, get a compliance budget, put it into place, and say, this is what it takes for us to do business. And this is what it takes for us to protect our profits, become a preferred partner, and also build patient trust equity. And this is what it costs to do that. And at the end of the day, it'll be a 10 times ROI from all those perspectives. Don't think about it as a cost center. Think about it as, I need to put this in place. It's a cost of doing business, which sounds like a cost center, but it also has a substantial amount of ROI. And I would actually ask your compliance officer what they think their ROI can be for the organization and how they're helping promote that. Are they being a strategic partner to operations or business development to help them go out there and show that this is a compliant organization or not? And I think that's really important to be able to do that. So when you're setting your compliance budget, don't let it get out of control. If it needs to be cut, do that. Make sure that you have a leader within your compliance program that is actually looking for it to be scalable and be efficient and effective in its operations.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show. We've covered a lot in this 3-part series. Before we close, I want to make sure you have the key moments you may have missed. The strategic insights on compliance ROI that every healthcare CEO needs. For organizations wondering what compliance actually costs and when to scale, Ross broke down the real numbers.
When you establish a compliance program, and it should run you anywhere from $150,000 to $250,000 as a small company, $250,000 to $500,000 as a medium-sized company, and probably over $500,000 when it comes to larger companies. And that 90% of what you're dealing with in a cost standpoint from a compliance program is salary and labor, right? That's going to be your number one cost. Your second cost is going to be your auditing and monitoring program, because you should outsource that to experts in the industry. And the third, probably most expensive cost, is your disclosure program. But when you think about that, is when do I scale? When do I go from a compliance officer who's fractional or even an outsourced compliance officer like we are? That is really based upon the risks that you're seeing as an organization. If you have a lot of government payers, like we talked about earlier, if 90% of your business comes from the government payers, invest in a compliance program. Invest in them, invest in a compliance officer. You're going to need that because you're at risk. Your risks are really high. If you're at 3, 4, 5, 10% government payers, your risk is really low. Maybe you have someone who's really fractional and part-time. When your risks get higher, when your payer mix goes up on a government standpoint, it means your risks get higher.
One of the biggest risks Ross highlighted is something that many CEOs don't fully consider.
One of the biggest kind of direct costs that people don't really think about when they think about a compliance issue that comes out is being excluded from the federal healthcare program. That's not money out of your pocket right now. That's money out of your pocket forever and going forward. It's your inability to make more money. And so if the OIG or CMS or the DOJ decides that your violations are significant enough they can say, we don't want you, we want you excluded. We want to exclude you from the federal healthcare program, right? The OIG, LEIE list of excluded individuals and entities. They will actually put you on that list, which means that you cannot receive any dollars from the federal healthcare program going forward. When you're excluded, 60, 70% of your revenue that you're counting on from Medicare, TRICARE, or TRICARE Campus and or Medicaid goes away. Who's going to lose 60 to 70% of their revenue? Now, if your revenue from the federal government's 5, 10%, your risks are lower, just like I said in the last question. You identify what your risks are, how much you're willing to lose.
Ross gave us a framework that completely reframes how to think about compliance ROI. He calls it the 3 Ps.
We call it the 3 Ps. The 3 Ps are very important for us. First one is profit protection. And when you talk about profit protection, the money that you lawfully made should be kept in your coffers. And the only way to do that is to ensure that you're doing it the right way up front so that you're not giving your money back. That's what a good compliance program can help you do on an ROI. Keep that money that you have and actually go forward as opposed to giving it back. The next one is preferred partner status. The preferred partner status, in my mind, is one of the biggest pieces that people overlook. We talked about it a little bit to say reputational harm, reputational cost. Nobody wants to do business with someone who's considered a bad actor or someone who's gotten in trouble. They just don't, because that smear goes on them too. So that preferred partner status can be provider groups who want to deal with hospitals, hospitals who want to have transfer agreements with other hospitals, payers who want to work with different providers or different hospital systems to say, yeah, we want to be part of your good network because you're not getting in trouble. Patients are getting good quality care. And at the end of the day, we see that if we build a partnership with you, we can change healthcare and we can make it a great place. So that preferred partner status is really important. In addition, if you're talking about being a provider group or a healthcare entity at some point in time, and you really want to be acquired either by a strategic partner or an investment partner, that is reputational risk too. They want to know that you have a good reputation where they're investing their money and they're investing their time, effort, and reputation in that company. And then finally is patient trust equity. That to me is the pinnacle. Our main job in healthcare is to provide great quality care so that patients can thrive. Once patients start trusting those providers to say, you're not going to order tests on me that I don't need just for money. You're not going to upcode this claim. Once you start creating that trust with the patients, they'll start coming back to you. You start gaining fans, you start gaining friends, you start gaining people who go, I trust this provider and I always will.
Earlier, Ross walked through how to assess your actual risk exposure.
Well, the first thing that I do is I sit down and I go, okay, let's talk about your revenue, your annual revenue. What is it across the board? Where are you at? Then I say, of that annual revenue, how much of that is government payers? Because literally government payers are the riskiest organizations because False Claims Act applies to them, anti-kickback statute, Stark, everything applies to government payers, whether it's state or federal. And then I say, okay, of that amount of money, which is your risk, that's what's at risk, how much you're willing to lose or how much you're willing to give back? 10%, 1%, 5%? Tell me what you want to do. Most of them say, well, nothing. And I said, absolutely. You don't want to give anything back, right? So if you're a $10 million company, let's say 90% of your business is Medicare, $9 million, 10% of that's $900,000. Are you willing to lose 10% of that? Of course you're not. And on the average, when you think about compliance, it's really about protecting those profits that you have rightfully put into place. And that's what your ROI is.
Ross, this has been such a practical conversation. I think a lot of CEOs are going to hear this and realize that compliance budgeting is really about strategic thinking and not just expense management.
You know, Cami, that's exactly right. I think the idea and the thought process is we don't have to spend an exorbitant amount of money on a compliance program. You just have to have the right people doing the right thing and building a compliance program that's scalable and practical. It needs to be effective and efficient in what it does, and it needs to meet all those elements of prevention, detection, and mitigation. You don't have to break the bank, and I would highly recommend not doing that. There are ways of making it more practical, like we discussed today. The healthcare leaders who are investing in their compliance program, they're the ones sleeping at night, and they're the ones who can focus on growth, and they can focus on running their business without worrying about what exposures that they don't know about. So I think it's a great topic. Appreciate you bringing all of these questions to us today. I love talking about compliance. I love talking about budgeting. I love talking about the reason why we do things as compliance programs.
Absolutely. Thank you for breaking this down so clearly. For all you listeners, if you found this episode valuable, we'd love to hear from you. And as always, thanks for listening to the Compliance Advantage.
Thanks, everybody. Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.